Southeastern Railway has wholeheartedly participated in this national endeavor, and we have a very vibrant COVID vaccination program to vaccinate our beneficiaries. Our beneficiaries in this railway total about 4.3 lakhs, and our aim is to cover them with two doses of the approved vaccine. Besides 4.3 lakh railway beneficiaries, we also have to cater to the public, the frontline workers of the state government, such as the policemen, the election workers. The vaccination program in this railway, that is at Central Hospital, Garden Reach, our divisions in Chakradharpur, Ranchi, Adra and Kharagpur, has been running successfully so far. We have given around 87,000 jabs to our beneficiaries, which includes about 54,000 jabs to railway employees only. We also had to ensure that our staff, the team of vaccinators, the people manning the reception, they all were adequately trained in the vaccination process. As we all know, the vaccination is through the COVID app. Now, special training had been imparted to all those persons of our hospitals to ensure that each and every vaccine dose was accounted for and entered in the COVID app. An awareness drive had to be taken amongst our beneficiaries so that one and all could be vaccinated against this dreadful disease. We had to ensure that strict COVID protocols were maintained in our vaccination centers so that the crowd could be, which was expected as usual in our vaccination centers, were protected from the dreadful disease.
Massive second wave, and overall we have treated more than 600 patients in our indoor department. All our beds in the hospital are ready to provide oxygen to our patients. We initially were testing our patients through central laboratories. Today we have an in-house testing facility in the form of an ultra-modern CBNAT machine. We do round-the-clock testing for COVID-19, and as a result of which, every patient who gets admitted to this hospital has a CBNAT report within 2 to 3 hours of his arrival. So I think that is one of the achievements that we've had. The second wave, of course, was a massive wave, and we had to increase our bed strength to about 140, and about 25 beds in a safe home. We had to increase our ICU bed strength from 10 initially to about 28. We were earlier using both bulk oxygen cylinders and PCCs, but now we have also almost installed a massive 13,000 liter liquid medical oxygen tank, which, God forbid, if we do encounter a third or subsequent waves of the COVID pandemic, we should be able to manage our oxygen much more comfortably. We are also in the process of establishing an oxygen generation plant, which should be with us maybe in another couple of months' time. To mention here, highlight the fact that the vaccination program is being carried out in various vaccination centers all across Southeastern Railway, in its divisions, subdivisions, and many health units as well. I would just like to highlight that during the course of this pandemic, we have treated more than 2,400 COVID patients. We have tested more than 10,000 patients for RT-PCR, and we are continuing, and this would not have been possible but for the dedicated service of all my colleagues, my paramedics, my nurses, my other paramedical staff who have worked round the clock, risking their own lives, and of course the help that we have received from the General Railway Administration has also been remarkable. So with these few words, I would not only like to thank all those who have stood by us during this pandemic, and also hope that we should be able to overcome this in the future.